treat the cavity that has been formed from bacteria and caries, the dentist still needs to do the drill and fill technique. For now, there's still no drill and heal one. So today we're going to talk about dental fillings and how we fill those holes that have been developed from bacterial infestation and bacterial infection, and what type of material can we use there. So in this video we're going to talk about dental fillings, and we're going to talk about what types of fillings are there available on the market. And if you stay till the end of this video, you will have a better understanding of it. Why do we choose sometimes this or that different types of fillings, and why should you remove or not remove some of your old ones. So stay tuned. First, when we as dentists see the dental cavity and we remove it with various drills. Before that, we usually use some dental anesthesia to numb the area so you don't feel any pain during the procedure. After that, we carefully examine the lesion and remove everything that is not healthy. Every type of tissue that has been infected by the bacteria accumulation and that it looks like tooth decay. This is simply done with drills, and after we removed it, after we removed all that infected and rotten part of the tooth, then we take the step to fill the drilling part, to fill the gap that has been happened because of tooth decay. If you want to learn more about tooth decay, tooth caries and tooth cavities, you should check my video regarding that topic. And so let's continue. Today we have several types of different materials for fillings. We have the restorations that can be done directly in the mouth, and we can it's called direct restorations, and we have restorations that can be done in the laboratory, which are called indirect restorations. All of them have their pros and cons. We're going to talk about them now. In some countries there are still available gold fillings. Gold fillings are a older generation of fillings, but it's considered even today one of the best fillings available on the market, because golden alloy materials for dental restorations have really good biocompatibility and have really good mechanical properties via connections with the tooth surface. So these fillings have a goldish color. For some patients there might even be a peeling that gold is a warmer color, so it's not so foreign to put them in the mouth. But they're really expensive and they're really used rarely in occasion. If you find a dentist that does golden fillings, indirect restorations such as inlay, onlays or overlays, you should definitely try to talk to him about it, see the pros and cons, because golden fillings can last over 40 years and still look the same as the day they were placed, if done properly, of course. When we talk about other metal types of dental fillings, these are all the popular silver amalgams, or how patients call them, the black fillings. So these fillings are not black, actually they're silver. They're composed of amalgamation between silver and mercury and other types of metals such as bronze, composite and something else. And the idea is these types of fillings have really good mechanical properties and are really simple to use. They are really cheap, they got good strength, and they got good durability. The weaknesses is their poor aesthetics. The problem is that they're mechanically connected with the tooth. So what does it mean? That they hold themselves between the remaining walls of the cavity mechanically. So you need to, this is a disadvantage, because if you have a small caries and you remove the hole and it's a small hole, you need to burr additional healthy tissue away to put in a dental amalgam filling, because of the mechanical retention that is required for the filling to fit and stay inside the tooth. Sometimes it causes discoloration of the tooth itself because of its color, and it can cause micro cracks in between the tooth and the filling, because that material has a degree of contraction and expansion over time, and can lead to higher incidences of cracks and fractures. Sometimes people are allergic to these types of metals, so this is also a negative side of amalgam fillings. But if done properly, they can also last for decades and even more. Of course, there is also the topic of mercury poisoning that people like to discuss about it, but these concentrations are so practically low that they are not even sometimes worth mentioning. And so when we're done talking about metal fillings, we can now continue on the composites, these more popular ones. Composites have been on the market for over 30 years and have been constantly developed, and there are different types of composites on the market depending on the type of restoration you need. For distal teeth that require composites more strength to resist, or more for aesthetical purposes that then are more reserved for the frontal teeth. So composites are basically high polymer plastics, I can call it, so you can understand it more easily. They come in a plastic form or in liquid form depending on the type of the composite, and they are chemically connected with the surface of the tooth. You need to treat the tooth before and after you place on the treated tooth the filling, composite filling. You form it like in a plastic way you want it to, and you polymerize it with polymerization lamp. It usually lasts 5, 10 or 20 seconds depending on the material itself. So these are composites. This is the benefits of composites, of course, are aesthetics. A less tooth has been needs to be treated if you want to retain it, because the connection between the tooth and the composite is mechanical and chemical, which is much better. It's using a special type of glue that connects the organical part of the tooth and the unorganical part of the composite. It's very versatile. You can use it for any scenario, from frontal to distal teeth. You can use it in also other types of dental procedures, for other types of solutions that are needed in dentistry, from sometimes provisional prosthodontics to some sort of surgery, sometimes even. Advantages are, of course, they're not as strong as metal fillings. Sometimes they can chip. They need to be replaced sometimes more oftenly. But today, with all the materials developing all the time, it's less and less frequent for composite fillings to create any sort of complications if done properly from the side of the dentist. Other types of fillings are also present. Other types of fillings, such as glass ionomers, these are special types of acrylics and glass materials that can be well placed, especially in let's say children, because they can be placed in a more not so clean environment, because children have a tendency not to stay still at your dental chair when you treat them, and because of it you need to be fast. You need to sometimes miss that the saliva goes into the filling, because when you do the filling, everything needs to be really clean. So the glass ionomers release fluoride, which is really good for the tooth structure to harden, to be better. So you can also sometimes combine different types of fillings. You can combine glass ionomers at the bottom of the filling and put a composite above. It depends on what your dentist do. And this is about it. Hope you like this video. Hope I gave you more information. If you have any questions regarding dental fillings and how they're used from our side, please leave a comment down below. Click the like and subscribe button for more future dental content, and check my other videos also, so you can be smarter regarding your own teeth and to prolong your dental health as much as possible. I hope to see you soon. Bye.